exercise I want to share with you right now has to do with how we can influence how the scapula moves and travels on the back of the rib cage, but how we do that by creating the separation between the rib cage and the pelvis through the bottom-up driver that the rotational aspect, the transverse plane motion of the Core-Tex platform provides. As we've touched on before, the platform not only spins the transverse plane, we're also going to get a tilt and a slide at the same time. So the amount of variability in what ends up happening to the ground in this case influences our segments all the way up. So the beauty of that is that we're introducing a whole lot of different neural recruitment, we're introducing a whole lot of variability in terms of the stresses and or loads on the tissues and the joints throughout. And it gives a lot of opportunity for the motor system to start to put together variations in catalogs or ways that it can recruit options for similar motions. So what I'm going to do is use what we would call our Core-Tex shoulder matrix, which is I'm just going to hit different vectors with my hand, different reaches with my hand. But as I do that, I'm going to be rotating the platform at the same time. As I rotate the platform, it's naturally going to cause the scapula to move away from the midline and then come back towards the midline as I coil and uncoil the relationship of the rib cage to the pelvis. So as I step on the platform here, what I'm going to do is just push it off to the side, and whether I'm facing straight ahead or facing to the side, I can give you multiple views on this. But if my left hand is my reaching hand, my feet are always going to go opposite the hand. So I can take my reaches here, and each one of these is creating a different effect. Show you on the opposite hand. I can combine that with some specific instructions or cueing with what I do with my hand as well to further influence how we load up the shoulder girdle tissue. So for example, I can take my hand and go through the motion that will be the D2 pattern of PNF. So if I was in this position, and I start up here with this big, long, eccentric load through this half of the oblique system, I'm going to come down like this. Notice the rotation of my thumb down here, loading up this glute at the same time, and then uncoiling up. So as I use that supination external rotation, that reflexively cues my scapula to downwardly rotate. That's on top of the fact that I'm coiling and uncoiling, which in and of itself is going to cause that scapula to do some beautiful things on the back of the rib cage. It's also going to be novel to the nervous system. So if we think about our clients or patients that are experiencing limited motion, inhibition, apprehension in terms of what they do with their shoulder, this isn't going to register with what historically has caused pain. And we can create movement that they're unaware that they're going through similar motions because it's coming from the bottom up. And we're getting that separation, and therefore it doesn't register as a threat any longer. So coil, uncoil, vary the positions. What do I want my scapula to do? How do I want that to relate to what my gleno-humeral joint does? I can think that through based on what I want my hand to do, where I want it to go, and what kind of rotations I want to present as cues to my patient, my client, or my athlete.